Unit 4. Health Messages on Air Filters. By the end of this unit, you will describe what to communicate to the public on the evidence on the use of indoor air filters to reduce exposure to PM 2.5 and the negative health effects. A systematic review was conducted to assess publications on the efficacy of portable air filters in reducing indoor concentrations of air pollution and mitigating health risks in real-world situations. Some clinical improvements were observed, including an overall reduction in systolic blood pressure, an increase in peak expiratory flow, and some overall improvement in several cardiovascular and respiratory health indicators. However, the changes in health measurements were not consistent across study populations. The observed improvements were generally greater in healthy adults than susceptible participants. Indoor concentrations of air pollutants of outdoor origin range from below 10% to close to 100% of outdoor levels, depending on the pollutant, the setting, for example, at home, office, or school, the rate of ventilation, removal, for example, active filtration, deposition, or reaction, and resuspension. Mechanically ventilated buildings equipped with heating, ventilation, and air conditioning systems sometimes have efficient air filters. Their efficiency in blocking pollutants from outdoors to indoors depends on the filter properties and the size of the filtered particles. In any case, air filters are not able to eliminate all air pollutants in indoor spaces. Exposure inside vehicles is usually higher than indoors or outdoor settings. People who spend a lot of time driving are vulnerable to greater health impacts, particularly in urban areas. Outdoor workers are also likely to experience higher exposure than indoor office workers. Advice on reducing exposure should therefore be provided to people in vulnerable occupations, such as street vendors or traffic officers. Some key messages for healthcare workers are, from a general population perspective, recommending the use of portable air filters is still premature and should be tempered in view of the lack of information on effectiveness in the real world. Filters do reduce indoor PM 2.5 in experimental settings. However, there is not consistent evidence. And there are possible environmental impacts of using filters, such as exposure to noise and the high cost of changing filters. And the use of portable air filters might be advised for some susceptible patients, for example, those with chronic respiratory diseases, heart failure, or lung transplants. But long-term studies of these populations are still needed.
By the end of this unit, you will describe how to communicate health messages to patients and groups in relation to the use of respirators. According to WHO, filtering face piece respirators are the most common type of air purifying particulate respirator recommended for use by the general public for protection from airborne particulates, such as PM 2.5. Respirators are intended to provide respiratory protection for the user. However, a wide variety are sold that do not provide respiratory protection, even if they cover all or part of the face. Therefore, these are not considered personal protection equipment. Respirators that filter 95% of airborne particles are called either N95 in the United States of America, KN95 in China, or FFP2 in Europe. These terms refer to the particle removal efficiency of respirators. However, the terms have not been patented or copyrighted, so they can be used by any maker even without proper testing. There are 5 factors that ensure that a respirator is effective. They are 1. Putting it on correctly, 2. Ensuring that it fits properly, 3. Continuous use during exposure, 4. change of the respirator or the filter when it becomes saturated, and 5. Confirming that it has been approved to remove 95% or more of particles. Because of facial anthropometric differences across the world, no single respirator can be guaranteed to fit all users. In general, for example, there appear to be few to no commercial respirators designed for children. A systematic review of studies on the use of personal masks or respirators in the context of air pollution was conducted to assess their efficacy in terms of reducing exposure to air pollution and mitigating health risks in real-world situations. The findings of this review were some overall improvements in variations in heart rate during short-term interventions. However, the changes in health measurements were not consistent in different study populations in terms of direction, magnitude, or timing of response. And most articles did not provide information on how well the respirators actually worked or fit. To determine the efficacy of respirators use, more high-quality studies with larger samples and longer follow-up in general and high-risk populations should be conducted. More information is also needed on the effectiveness of respirators in real-world conditions by both healthy and susceptible populations. In particular, more data should be provided on the effectiveness and tolerability of respirators. Given the evidence that respirators with very high theoretical effectiveness often have limited or no effectiveness in real-world conditions, their use should not be recommended against air pollution at the general population level. Use of respirators can be recommended in situations such as occupational exposure. They may be necessary for short periods in situations such as wildfires, volcanic eruptions, desert dust episodes, or cleanup after a disaster. Here again, a special caution should be given for people with respiratory diseases for which it may be not advisable to use a respirator due to increased lung-related dead space and resistance. Rather, the recommendation should be to continue and intensify action to reduce air pollutant emissions. Personal activities to reduce or limit daily exposure may be necessary.
By the end of this unit, you will outline potential unintended consequences of changing behavior to reduce exposure to air pollution. There is the possibility that public health interventions to reduce exposure to air pollution may have unintended negative consequences. Healthcare workers must be aware of and prevent these unintended effects. Let's look at some examples. Efforts to avoid air pollution exposure might reduce the benefits of outdoor physical activity. They may also reduce social interaction. For example, children may be discouraged from playing outside, or people may be reluctant to leave the house. This could be detrimental for children's development, both physical and mental, as well as the overall mental health of individuals. People who are more susceptible to air pollution may also be more susceptible to the adverse effects of some interventions, such as increased psychological and physiological stress and increased cardiorespiratory demands of wearing a respirator. Finally, higher costs may result from increased energy use, for example, for air purifiers and filters, and mechanical rather than natural ventilation. All of these consequences may negate the intended benefits of the reduction measures.
By the end of this unit, you will describe the key role of health workers for cleaner advocacy. Healthcare practitioners are mainly preoccupied with the clinical care of their patients. However, their role also extends beyond the clinic to involve their patients' family and their communities, either urban or rural, to protect and promote people's health and well-being. It can be challenging working out which type of health and preventive messages and measures to provide to individuals and the community with regards to air pollution, but health workers and caregivers have a big role to play. There are some key principles to remember when acting as an advocate. The first principle is to use the evidence base. Health professionals need to respect the evidence base and not use any unverified data or information. The evidence base is derived from scientific literature or other credible sources, such as institutional and intergovernmental reports, including WHO websites, data, and publications. If available, it is important also to consider local data on exposure to air pollution and morbidity and mortality data. WHO has also developed tools that can be used to quantify the health impacts of air pollution in a given population to guide policy interventions, especially interesting for public health professionals. We will look at these in more detail at the end of this module. The next principle is to maintain credibility. Health workers have significant credibility and are seen as a trusted source of information, often more so than government and other scientists. This respect is dependent on arguments remaining carefully evidence-based. In thinking about possible ways to be an advocate, it is important to seek and clearly define effective interventions. For example, what policy interventions would have a significant positive health impact? What are the key policy issues related to improving the air quality? Is there a role for health evidence to support policy planning and implementation, for example in rural and urban transportation, energy, waste, agriculture, or household air pollution? When planning advocacy or community interventions, it is important to first understand who else might be involved. For example, are public health professionals working in the area? Could their work be supported? Are there researchers in this area? Their data would be useful to guide work. Are there non-governmental organizations active in air pollution? If they are reliable and evidence-based, there might be an opportunity to work with them. Can health workers act outside the clinic as community advocates? Health workers cannot act alone, so it is important to seek out other individuals or groups, including experts or practitioners in other disciplines, that would complement or support interventions. Such co-advocates must be credible and hold evidence-based views. As an example of this, healthcare workers are not experts on transportations, but as a team they can contribute evidence regarding the health impacts of transportation-related air pollution.
By the end of this unit, you will outline some of the ways health workers can advocate for clean air. Health workers can demand action and promote collaboration between all civil society relevant actors, political parties, and institutions. Power structures will differ depending on location, and it can be difficult to understand who holds the strings. Local advocacy groups can be invaluable in understanding who controls what and in coordinating advocacy action. You can lead by example and think about what role you could play in disseminating information about air pollution, as well as how health workers could push for political action towards clean air. Some examples are presented in the reading material. In addition, health workers can also promote the integration of air pollution in medical school curricula. In 2020, only 12% of medical schools worldwide provided any formal education on air pollution and health. In addition, disease guidelines, for example for pneumonia and non-communicable diseases, frequently do not address air pollution and health issues. Health workers should work with associations of health professionals and teaching institutions and related ministries in their country to make climate and air pollution literacy a mandatory requirement for all clinical education programs. Healthcare workers can also increase education on air pollution by doing some work in their community, for example, publishing a fact sheet or article, giving a TV interview, making a podcast or blog, or working in or from a clinic or hospital. Training colleagues and medical students via lectures, workshops, webinars, or other formats, and working or collaborating with health organizations or other professionals. Finally, it is important to promote self-efficacy, the belief of individuals that their actions can have an effect. An example of self-efficacy is citizen science. Citizen science is a form of science that meets the needs and concerns of citizens and is developed and endorsed by the citizens themselves, supported by scientists. Citizen science, through speaking out on air quality issues, can raise public awareness in communities, encourage behavioral change, and foster policy action for mitigation strategies to reduce emissions.